Hello and welcome to the State Draft. I am Purva Chitnis, special correspondent with ThePrint. Today in this episode of State Draft, we will be talking about why are so many people in Maharashtra dying at their government hospitals. Is it a half-hearted solution and the same old story? Well, for the past 1 week, patients dying at various Maharashtra government medical colleges dominated the headlines. ThePrint visited one such GMC in Chhatrapati Sambhaji Nagar, earlier known as Aurangabad. Here we spoke to patients, doctors, activists to know what the situation is on ground. Here also, on one day, 14 patients died. The Dean, however, says that this is just 1% of the total admissions and check out our recovery rate instead of the death rate. But Mehraj Patel, a member of the management committee, also known as Abhyagat Mandal at the Ghati Medical College, which is also known as the Aurangabad Government Medical College and Hospital, admits that there is a shortage of medicines at the facility. She told ThePrint that the machinery is not in large numbers. CT scan, MRI takes time. The inadequacy of medical equipment is leading to delayed treatment and people are forced to go to private facilities. And this is not the doctor problem, but the problem of the system. The Ghati Government Hospital is among the public healthcare facilities in Maharashtra, including the Nanded Government Medical College and Hospital, that have counted headlines for the past few weeks over the suspicious number of patient fatalities. The incidents have once again brought to light some of the factors that have been known as the bane of government hospitals in India for years. These includes lot number of vacancies, patients who are severely ill coming to the government facilities as the last resort, and delay in release of sanctioned funds for operations. There have been allegations of medicine shortage as well. In the case of Nanded, CM Eknath Shinde and Medical Education Minister Hassan Mushrif have denied that there has been any shortage of the medicines, and this has been the case even at Aurangabad or Nagpur hospitals. However, in Chhatrapati Sambhaji Nagar, patients and staff who spoke to ThePrint talk about the problems faced while buying and procuring medicines. Health activists, meanwhile, also say that government's half-hearted attempt to plug gaps in the state's procurement policy is also one of the reasons why hospitals are plaguing at this point. ThePrint reached out to Dr. Dilip Mahsekar, Director of the Directorate of the Medical Education and Research, which is the DMER, responsible for looking after all of this, and note that he's also the Dean of the Nanded Government Medical College, for a comment, but the calls went unanswered. Also, the calls to Mushrif went unanswered. Speaking to ThePrint, however, retired Principal Secretary Mahesh Zagre described the problems facing Maharashtra government hospitals as holistic in nature. Now, Mr. Zagre said that first of all, a proper study needs to be done on the number of patients coming to the hospital and then whether there are adequate beds, equipment, and also whether the staff is well trained to handle the influx of patients. He also said that secondly, the medicines need to be monitored. What type of medicines are required, and whereas the procurement of these medicines is done timely and is proper, also needs to be monitored. The Bombay High Court, while hearing these cases, has taken a suo motu cognizance and came down heavily on the state government last week. The Bombay High Court in its order said, the state cannot escape the responsibility by saying that there is burden. You are the state. You cannot shift the burden or responsibility to private players. Now, in all of this, there has also been a change in Maharashtra's procurement policy. Now, in 2017, the state government set up a wing at the state-owned Hafkin Biopharmaceutical Corporation to procure medicines as well as medical devices and equipment and distribute them across medical colleges and hospitals. Now, every hospital, however, was allowed to use 10% of funds to procure medicines and equipment to tide over any lack or emergency. A government hospital requesting anonymity told ThePrint that procurement through Hafkin regularly resulted in delays. The officers said that they used to give Hafkin requirements and they were allowed to spend 10% of the funds in case of emergencies or delays from Hafkin. But the order used to be delayed for 3 to 4 months and we had to keep the medicines quarantined for another month to check it out. The officer also said that they used to give the medicines in bulk and if the requirement was lesser, then the rate used to go up. Now, the two officers that ThePrint spoke to said that every year hospitals would send their requirements to Hafkin by March. Now, because of these delays, various hospitals used to procure medicines locally. As the delays come to the government's notice, it decided to set up another single point source of procurement for medicines and medical devices. To this end, in March 2023, the state government passed the Medical Goods Procurement Authority Act. Now, according to the Act, all procurement and supply of medicines, medical equipment, devices and goods was to be done at a single point authority. 6 months down the line, however, the law's implementation still hangs fire. The body, for one, does not have a chairperson or CEO, a fact which is also noted by the Bombay High Court. The Bombay High Court in its ruling said that till date, a full-fledged CEO of the Medicine Procurement Authority has not been appointed and only an additional charge has been given to another officer. The Bombay High Court said that the state government needs to make these appointments within 2 weeks. The government subsequently said that the appointments will be made on an urgent basis. Meanwhile, one of the doctors at the Ghati Hospital in Chhatrapati Sambhajinagar told ThePrint that its capacity is to treat over 1,100 patients daily, but they see an influx of around 2,000 patients. The government used to give us medicines to treat only about our capacity, is what the doctors told us. So how are we supposed to treat the patients that are coming in every day? This is what the doctors have been saying at the Ghati Hospital. Last Friday, the management committee also wrote the letter to the hospital saying that for the past 5 months, about 5 crore rupees has been sanctioned via the District Planning Development Committee to procure medicines, but it hadn't been done yet. Hafkin also allegedly did not procure any medicines for this year, according to the letter. ThePrint has reached out to Hafkin via email, but they did not respond. ThePrint also spoke to health activist Dr. Abhijit More, and he says that the shortage of medicine is a recurrent problem in Maharashtra. He says that because of these arbitrary purchase of medicines and costly medicines earlier, the government started following the Tamil Nadu Medical Service Corporation model to enhance transparency in the system. But he says that it was implemented half-heartedly. The medicines that should be there at the hospitals are not easily available and the people have to purchase those medicines from outside. The government does not have a consistent policy around medicine procurement and it keeps on changing from time to time, creating confusion, is what Dr. More has to say. But there are also some legacy issues. That infrastructure and staff issues plague the medicine colleges across Maharashtra is well evident. Even at the Ghati Medical College, many patients in wheelchairs were being ferried by their relatives instead of staff members. Here, the patient mentioned how they were given name of the medicines to be brought from outside and they were not being procured at the hospital premises itself. The appointments for MRI scans, CT scans were delayed and they had to put up their own patients on the wheelchairs and stretchers and no help came through. And this is not the condition of one particular hospital or government college, but it is the condition across Maharashtra. Abhay Taksal, who is the human rights activist in the Marathwada region that ThePrint spoke to, said that this is the condition at all the hospitals across Maharashtra. He said that at Ghati Government Hospital, they did not have wheelchairs or stretchers earlier and the NGOs and other civil society members pitched in to get those wheelchairs and stretchers. He also said that the system is not functioning properly at the government hospitals. In its observation, the Bombay High Court said that the health sector in Maharashtra is clearly in decline and it pointed out that the health allocation for 2020-21 was 4.78% of the total budget. It rose to 5% in 21-22, but in 2022-2023, it went down to 4.24%, and in 2023-2024, which is the current financial year, it is at 4%. As a result of the deaths at these hospitals, the government told the court that patients are often brought in when they have exhausted all their options at civil or private hospitals. And this is what the doctors at the government medical hospitals also agree, that the patient load is higher in the government medical colleges because that is the tertiary care, and once the patients exhaust all their options after going to the private hospitals and civil hospitals, they then are referred to the government medical colleges. The dean at the Ghati Hospital told ThePrint that their daily death is 14, which is on an average of the influx of over 2,000 patients, and they say that they treat 99% of their patients. So the senior doctors at the hospitals also said that the primary job of the government medical college or hospital is to teach the medical students, and because they cannot refuse patients, they have to also admit them at the hospital. But that is not all. In fact, vacancies are another issue. In August, Maharashtra Health Minister Tanaji Sawant said 11,000 posts in the C and the D categories in various government hospitals and health institutions will be filled soon. As many as 30% of positions are vacant at the Ghati Medical Hospital, according to the Management Committee's letter. Of these, the post of Medical Secretary, 22 medical officers, and of resident medical officers have been vacant for 12 years, the letter said. There are 320 Class 4 vacancies, of which 115 have been outsourced, said the Dean at the Ghati Medical Hospital. This is the situation even in Nanded Medical College, where 47 vacancies as against 325 sanctioned posts, including of professors, assistant professors, associate professors, class 3 and class 4 positions. There are 48 vacancies against 97 sanctioned posts for senior residents, according to the report of the committee formed to look at the Nanded deaths. Now, experts say that outsourcing of hospital work could be problematic because there will be no supervising authority, and the supervising authority will not be stringent as against getting these employees permanently. Because the experts say that if these employees are outsourced, then the executing and supervising capacity of the hospital goes down and the system is hence collapsing. The experts also say that the government has key roles in health and education, and they have to take an active role in it. Funds are also another problem. Now, in fact, taking the example of the Ghati Hospital, 30 crore was demanded by the authorities for the annual expenses, but the government sanctioned only 10 crore, and so far only a meager amount has been released, is what the sources at the hospital said. The experts point out hence that the political will is very important, and this is what will ail the healthcare system in Maharashtra and across the country. Now, in the public health sector, Taksal says that best of the best doctors should be available at a good salary so that they can stay back and work at these hospitals instead of giving priority to practice privately. Political will is important to change the system and strengthen the public health system, and there should be faith in these hospitals for people to first come to the government hospitals and not treat it like it is the last option. And this is what the experts have been pointing out all through, that the bureaucracy and the lack of the will is the problem. And this is a government issue that has been plaguing the healthcare system for a long time. Now the government has woken up and initiated what it calls the Vision 2035, where it says the focus of healthcare is improved and funds will be pumped in to boost the infrastructure. But the experts say that it is too little and too late. That's all we have for you in this episode of State Draft. Do tune in for more such episodes on ThePrint.